Falls can happen to anyone, but are more likely as we get older. Causing serious injuries or longer-term conditions, they contribute to many hospital admissions. They can affect personal confidence, and after a fall, there is a greater chance of the same thing happening again. But don't worry, there are a few simple actions that everyone can take. We will show you how to stay safe whether you're at home or out and about. For your physical health, there are 6 areas to consider. Balance, reaction times and reflexes get slower as we get older, so try to plan in enough time to do things. Do simple, safe and regular exercises which are designed to help this. Because we also lose muscle and joint strength, it's important to exercise to stay strong. A little every day is the best approach. Weight-bearing activities also help bones, which become more brittle as we get older. A healthy, balanced diet with enough calcium will maintain bone strength, and vitamin D from sunlight, food and supplements will ensure it is absorbed. Rushing to the loo makes falls more likely, so seek support if you have continence concerns. If your medication makes you dizzy or drowsy, talk to your GP. Regular reviews are your opportunity to discuss any concerns. Eyesight deteriorates as we get older. Have an annual test and don't delay if you notice any changes. There are 5 key areas to focus on when looking at your well-being. Getting back your confidence after a fall or being less fearful about the possibility relies on taking careful but positive action. So in safe spaces, avoid too much time sitting around, stay active but be sensible. If you have had a fall, work through the causes and then put it behind you. Keep connected by always carrying a charged mobile phone when out and about so that you can easily call those who support you. If you have any long-term conditions, make sure that you understand how your symptoms or medication could contribute to the possibility of a fall. Work out the best strategies to limit risks, whether they're time or environment related. Enlist friends and relatives to help you. A problem shared really is a problem halved. So spend time with them doing the things that you enjoy to stimulate your body and your mind. Lastly, be careful with alcohol. We all become less able to process the same amount we could when we were younger. Many falls can be avoided with a few small improvements to our surroundings. Here are 7 areas to consider. Whether inside or outside, and particularly when travelling on foot, be aware of trip hazards. Ensure good lighting inside and outside your home. Avoid dark and poorly lit public areas at night. Arrange your home space to avoid overstretching, particularly in cupboards or other small spaces. Dispose of clothing and footwear which either snags or fits you poorly. Keep a consistent, warm temperature at home. Being cold can lead to huddling or shuffling, both of which can cause falls. Avoid rushing, particularly in unfamiliar areas where hazards could be easily missed. Do not venture out in poor weather. Instead, ask those around you to help with things like shopping. Food and drink is another key factor. Here are 5 actions to take every day. Keep hydrated. It's essential to avoid many conditions that can contribute to falls, including both dizziness and confusion. For peak mental and physical health, drink 6 to 8 cups of water every day. It doesn't have to be plain water, so drink what you enjoy the taste of, and that will also make taking your medication much easier. Eat a healthy, balanced diet, as it fuels everything else you do. Keeping your strength up and your body working properly will greatly reduce the chances of a fall. Eat small amounts regularly, especially when you don't feel like large meals. And lastly, don't forget to take care of your teeth or dentures so that you are comfortable and can avoid any pain while eating. Equipment can help us to avoid falls. Let's look at the 4 key considerations. When you need to, ask for help. There are lots of professionals who can advise you on the right equipment to keep you safe and comfortable. Never be embarrassed about needing equipment. The best course of action is always to find solutions to avoid a fall wherever possible. Only use the right equipment, whether that's non-slip mats, grab rails or something more specialised. Regularly check that it is in good working order and replace anything which is worn out or broken to avoid any unnecessary accidents. For more information about falls, visit our website.